There is a diagnosis in the history of medicine so bizarre, so widespread, and so accepted that it is almost impossible to believe it was real. It was called hysteria. And for nearly 2,000 years, it was one of the most commonly diagnosed conditions on the planet. The word comes from the ancient Greek hystera, meaning uterus. Because for most of recorded medical history, doctors believed the uterus was capable of wandering freely around the body, detaching from its position and drifting upward into the chest or the brain, pressing on organs and causing illness, and the illness it caused could be almost anything. Feeling anxious, hysteria. Feeling sad, hysteria. Too emotional, too irritable, too tired, too energetic. Fainting, not fainting enough, loss of appetite, excessive appetite, all of it. Hysteria. By the 19th century, hysteria had become the most commonly diagnosed condition in women across Europe and North America. Some physicians estimated that up to a quarter of the entire female population suffered from it. It had its own specialists, its own textbooks, its own hospitals. The most famous of those hospitals was the Salpêtrière in Paris, and its most famous physician was Jean-Martin Charcot, the father of modern neurology, a man of genuine brilliance who nonetheless spent years presenting hysterical women to lecture halls full of male doctors as living demonstrations of a disease they were all certain was real. Charcot described hysteria in precise clinical terms. He catalogued its stages. He photographed its patients. He turned it into a science. And the treatment. The treatment had been the same for centuries. Physicians performed what they called pelvic massage, manual stimulation of the patient until she reached what doctors euphemistically called a hysterical paroxysm, in plain terms, an orgasm. This was written in medical textbooks. It was billed as a clinical procedure. It was considered entirely non-sexual because the medical establishment of the time had decided that women did not experience sexual feelings in the same way men did. Doctors genuinely believed they were treating a medical condition. Patients genuinely believed they were being treated. The treatment was so common and so time-consuming that physicians began complaining about it. Rachel Maines, a historian of technology who documented this history in her landmark 1999 book, found widespread evidence that doctors considered pelvic massage tedious and exhausting work. They began delegating it. First to midwives, then to mechanical devices. Hydrotherapy clinics offered pressurized water jets as a form of treatment. And by the late 19th century, early electromechanical devices began appearing in medical catalogs, marketed not for sexual use, but as labor-saving tools for the overworked physician. The vibrator was not invented for pleasure. It was invented because doctors were tired. The diagnosis of hysteria began to collapse in the early 20th century, largely due to the work of Sigmund Freud and Joseph Breuer, who argued in their 1895 publication studies on hysteria that the symptoms being called hysteria were in fact psychological, rooted in trauma, repression, and unresolved emotional experience. They were not entirely right either, but they were closer. By 1980, the word hysteria had been officially removed from the Diagnostic and Statistical Manual of Mental Disorders. After 2,000 years, the diagnosis was dead. What had it actually been? Historians and clinicians now believe hysteria was a catch-all container for everything male physicians didn't understand about women: anxiety disorders, depression, sexual frustration, the physical effects of corsets and malnutrition, and the psychological toll of having almost no autonomy over your own life. The treatment worked, in a sense, not because it cured a disease, but because it provided relief from something real that medicine refused to name correctly.